Couple of things that we want to talk about. First, if you wouldn't mind, if you could give an overview of where the Community Health Center is and what you do, because though you're not located right here in town, you do serve our community.
Yes. Community Health Center is a local nonprofit that provides addiction, treatment, and recovery services to adults and adolescents in the area. We do primarily serve Summit County because we are located in downtown Akron. However, we can serve any county in the surrounding communities. So we do have a patient base here in Medina County and surrounding counties such as Stark, Portage, things like that.
And you do detox as well?
Yes, we do offer Adolescent Detox. It's for ages about 15, we're thinking, to about 18 to 21, kind of an older adolescent. And detox is important for people when they are withdrawing from opiates. It's a medically monitored environment. It can last 3 to 5 days. And during that time, we engage the young person immediately in treatment. They're monitored by our doctor and nursing staff. And then after that time period, they would graduate into an intensive outpatient treatment program.
You mentioned that it's a holistic array of things. Holistic in terms of the way you treat?
I would say holistic in the way that our vision is to offer an entire continuum of care. So we offer all kinds of different services to address the many needs that people are facing when they're struggling with addiction. The agency has been around for almost 45 years. So we're not new kids on the block. We've been doing this a long time. We've been a leader in the area of addiction treatment, and really, whether you're insured or not, whether you have means to pay for your treatment or not, Community Health Center is a great resource because our professionals have been doing this a very long time.
Now, Chrissy, you are a Wadsworth resident,
Yes.
and I know you're passionate about the addiction fight, not just because of where you work, but you're also part of the Wadsworth Drug-Free Community Coalition. And I'd like if you could talk about maybe, why your heart is with this fight.
Well, we are new to the Wadsworth area. We've only been here, we've been here a little over 5 years, but I was just looking to get more involved in the community. And when the heroin epidemic was starting to kind of really rear its face in our area, we were seeing it in Akron, and then I started reading about it in the Post, and I saw a group of people were getting together talking about it, and then I started investigating a little bit. Hey, what's going on in Wadsworth? What's going on in Medina County? I really understand the network in Summit County. There's a large network of providers, and when I realized Medina was really on the short end of that, and we really had a long way to go, I just felt really compelled about getting involved. And I think Wadsworth is this extremely collaborative community, and I thought we can figure this out. So, it's my wheelhouse. I've been doing it for 15 years and helping make connections with people throughout the community. So I thought we can do this here. And I find Wadsworth to be a community that also skews towards Summit County a little bit. We're really close. I commute to Akron every day, as I'm sure many of your listeners do. So I thought maybe there's some connections there where we can get people the services they need, even if it's not right in our neighborhood. But, we're working on it. We've got some stuff going, so it's really exciting.
For some people who are listening, for example, my aunt lives in Richfield. They lost their son a year ago on the 20th to heroin. They're always looking at getting something in their community. How hard is it? Is it challenging? Is it hard? How do you bring something bring help to a place that there isn't yet something available?
Well, we faced that in Wadsworth with Lakota joining the community. So I would implore upon everyone what a wonderful accomplishment that was. From the standpoint as being a part of an agency, when I know we go into a community, we actually have had offices in Richfield in the past. A community reaches out and says, hey, we have this huge need. But, establishing an office, even on a part-time basis, requires a lot of logistics and funding. And even for a nonprofit, we still can't just lose money on it. So for an agency to come out here and establish new services, I think is a huge step in the right direction. It's tough to make the case because it seems like, oh, well, you guys have a lot going on out here. And then when you really look at it, there's really not a lot of local options for people. And I feel really strongly about you shouldn't have to go out of town to get help if you need it. So, looking really close, within a 30-minute drive, we should be able to connect people to services if they need them for addiction, because people are at a time in their lives where they're in crisis. They can't always afford a ticket out of town. And like I said, I really believe that there's a lot of wonderful community providers who are very, very qualified to help people fight addiction right here in our community. We just have to help them make that connection around town.
As you're well aware, September is Recovery Awareness Month, so a time to celebrate recovery. Can we talk a little bit about, and if not specific, that's okay, but some of the good stories, the recovering stories that are coming out of the community health center or have come out of the community health center?
Well, we offer a lot. Right now we're focusing on opiate addiction treatment, obviously, because that's sort of the hot topic right now. We have a very large opiate addicted population in the center right now. We have almost 700 people on opiate medically assisted treatment for opiate addiction. So what that means is they're on a medication program and they work with our doctor in long-term recovery. Of that, we have hundreds of people who are in long-term recovery. They're reuniting with their children. They are establishing housing. They're getting a job. Really, we're changing lives and saving lives every day. And time and again, I meet these women who are coming off the streets. They may be heroin addicted and pregnant. We get them into detox. They get on the appropriate women's program. We put them in housing. And our goal is to help them deliver a drug-free baby, and they do. I see it every single day. So there is a lot of hope out there. I know that it's so cliche, relapse is part of recovery, but it's absolutely 100% true. I met a young girl who had been through treatment 5 times, and this time she said it just felt different. And you really just have to get the person where they are. I hear our staff say that a lot. You just kind of get the person where they are and work with them, and you got to just keep at it. I mean, it's just a really long process.
Want to talk, before I jump into talking about medically assisted treatment and its misconceptions, wanted to ask you if someone listening needs help through the community health center, how do they get the help that they need?
Okay. We accept Medicaid, we accept private insurance, so people can come into the agency for an appointment by calling our intake department at 330-315-2644. That is the place where all of our patients start. People are assessed then for their level of care needs. So someone may be prescribed to intensive outpatient programming, which is like a 3 to 4 day a week program for several hours. They'll be assigned to an individual counselor. They may be assigned to medically assisted treatment using a modality like methadone, Vivitrol, or Suboxone, which is becoming more and more used. And then we just work a program with them and keep going as long as we can to get them on the road to recovery.
So you've mentioned some of the medical treatment side. I like the Vivitrol because it's something that you can't take with you on the street and sell,
Yes.
Maybe like some of the other medications available. So can we talk a little bit about this medically assisted treatment and the misconceptions that go along with
Yes.
it? Because I know this is also your wheelhouse.
Yeah, I feel strongly that medication-assisted treatment should always be an option for people. There are a lot of people out there that feel like, abstinence is where it should be, and we agree. We would like people to be completely abstinent from substances. So we're all in agreement there. However, we have addictionologists on staff and medical staff that use medically assisted treatment as a tool in the toolbox to treat someone. I'm sure you guys have talked and heard ad nauseum about what happens to the brain when you're addicted to opiates. And there's a lot of people talking about it in a way more informed way than me. However, addiction lives in your midbrain. That's the part of your brain that handles survival. You need to get food, find housing, stay safe. Your addiction lives there, and it takes over your brain. It kills your personality, your conscious, the things that make you who you are. And you'll do anything to get your drugs because you need to survive. Your brain thinks it needs it just as much as it needs food. So if you come at the standpoint as addiction is a brain disease, sometimes medication is necessary to kind of quiet that midbrain so you can raise up your frontal cortex, your personality, the person you are, and raise it up, get stronger so you can fight that addiction. And so we believe medically assisted treatment is a really great tool. So when an opiate addict comes in and they've request medically assisted treatment, they are assessed by a doctor and the nursing staff. They get a full physical, an EKG, all kinds of things. Then they are regulated on either methadone, sometimes Suboxone, and then this newer program, Vivitrol, which is a monthly injection. But methadone really does have, I think, sort of a bad rap. We've had a methadone clinic at Community Health Center since 1974, I think. It's highly regulated. There's only 12 or 13 in the whole state of Ohio because it's highly regulated by the state. We have a DEA number. We get drop-in visits, things like that. Our patients are monitored while they take the medication. It comes in a liquid form. They have to swallow it in front of our nursing staff. They're subject to random urine drug screening, so they get no warning, and they see their counselor on a regular basis. So we have people coming in every single day. They're not selling it on the street. And then Suboxone is given out on a limited basis. But most of the time, our Suboxone patients for a while do come in every day. And it's different than just going to a regular pain management or Suboxone doctor. Our Suboxone patients are subject to the random urine drug screening, the counseling component, the meetings, all kinds of things like that. So I really would like people to understand personally that the real buzz out there is there's not enough residential beds in our community in Medina County, Summit County, everywhere. But residential obviously is extremely important, but a lot of our patients that come in the door start at an outpatient level. They would start at an IOP, maybe with some medically assisted treatment if they need it for their opiate addiction. And then if that doesn't work for them after a period of time, we would elevate them to residential care. So the thing I like to tell people is there's hope out there. Just because you can't get a residential bed doesn't mean that your friend, family member, coworker, whomever you may know that's addicted, they can get better in their own community.
Well, this may be throwing a big lasso around the idea too, but as far as the medically assisted part, if you have high blood pressure, the doctor will try and, it's great to do it natural with diet and exercise, but sometimes that doesn't work.
You're totally right.
Sometimes you need the blood pressure pill.
Yes.
And it's the same thing. I mean, it's along the lines of whether it's faith-based recovery or group therapy. One works for one works for another, and sometimes there's a gray area in between. So it's along the same lines as blood pressure.
That's a really good point. One of the doctors in the area that talks a lot about this, her name is Dr. Nicole Labor. She compares it to diabetes. We wouldn't take insulin away from a diabetic, and I get they didn't choose that disease, but she also talks about how we treat people that are in addiction programs. Even at my agency a long time ago, if you had a relapse or chronically were relapsing, you would get discharged from the program. Well, we're kind of looking at that different now because a diabetic, if they don't follow their diet and their health suffers, their doctor doesn't go, well, you can't come back because you didn't listen to me, or we're not going to give you your medication any longer. So it's kind of about switching your perspective a little bit, and it's also realizing that people who are addicts, their bad behavior is a symptom of their disease. That's not an excuse. Okay, they need to work their program, work a faith-based program. Actually, spirituality and faith live in the same part of the brain that addiction lives in. So that's why like a strong 12-step program and AA is so important to people in their recovery. And their real success. And Dr. Labor has said just recently to me in a presentation, she never gets someone through St. Thomas Detox that says, that 12-step program let me down. It didn't work. They usually say, well, I stopped going to meetings. I wasn't working the program. I didn't contact my sponsor. So yeah, really everything needs to just really work in tandem. And I would just encourage people to be more open-minded about medically assisted treatment, because you get a lot of that hard line, like, no, that doesn't count. It does count. And you don't have to stay on it forever. It can be a limited program. We help people get off methadone and Suboxone all the time. It's still tough. You do it over a long period of time. But with any medication, even that you get from your doctor, you can't just stop taking it cold turkey. So, there's a lot of stigma out there about that too, and we'd like to bust that a little bit.
You had mentioned, and hopefully we have time to cover this in the detail that it deserves, but addiction related to pregnancy. We have someone who's coming on the show, recovered, and I say recovered because she'll tell you she ain't ever going back. Her name is Angel Daig, okay. And I don't know if she got help through your center, but I know she got help. I don't want to give away too much of her story, but she attends my church.
Oh, great.
And years ago, she began coming once she was recovered, and she was pregnant on the street underneath the Y Bridge, and had her baby, I believe, behind bars or something of that nature, but she's completely turned her life around. So maybe if we could talk about a little bit about how you help people who are addicted during pregnancy and what the outcome is for the children.
Well, women facing addiction while pregnant is huge right now. There were years in the past where we served maybe 5 or 10 a year. We had 82 pregnant women in treatment in 2015. So it is very pervasive. 60 or so of those women delivered drug-free babies. Now, many of those women are treated with Subutex while they're pregnant. We still consider that drug-free, or they are born drug-affected, but they're drug-free because the mothers are not using IV drugs. They're not living on the streets. They're getting their regular appointments, their vitamins. They're taking care of themselves like any of us would when we're with child. They're engaged in treatment long term. So they are practicing safe behaviors and they're healthy. What I would also say is that what we do with our pregnant women, and I'm sure many other programs, maybe the one that the person you spoke with experienced, especially in Summit County, if she was in one of the hospitals in Akron, there's an extremely strong warm handoff system into the community. So if someone comes into City Hospital, a pregnant opiate addict, they are immediately fast-tracked into our program, our women's recovery program. They are stabilized on medication. We work with the doctors there at the hospital and with our doctor. And then we just really keep a tight hold on them. We have a women's case manager that takes them to all their prenatal appointments, works with the hospital. We bring them to the labor and delivery unit so they know what to expect from their experience. A lot of addicts, and really people in general, when they've experienced trauma, they assume that they might be being discriminated against. So we teach our ladies things like, okay, you're going to be in this special unit with your baby. It's not because anything's wrong with you. It's not because they're judging you or they think, oh, that addict can't be with the other patients. It's because we're giving you a special place to take care of your baby. They let them know that when you call your call light, if they don't respond right away, it's not because they think you're a jerk and you're an addict. It's because they've got 5 other patients. So they tour the unit. They learn what the nurses are going through. Everyone's expectations are leveled. And then going into the hospital to have their baby is not traumatic, like maybe many of their other hospital stays where they were walking into the ER after an overdose or maybe drug seeking, or, it's some things can be triggers for addicts across the board. So we work really hard to just take away all of the nervousness that might exist around that. And then after the baby's born, our ladies, if they're in residential, they can bring their babies back to treatment with them. We have daycare on site. We work on parenting skills. We work on safe sleeping. We work on, all of the things that go along with having a newborn, the sleep deprivation, everything. It's really tough. And we work with them from top to bottom. And then hopefully by the time someone graduates from residential, they have housing. We assist with helping them find housing in the community. We have some housing programs, but if not, they can obviously get certificates from other folks and get their housing lined up, and then they continue in outpatient programming. So I believe strongly in the women's recovery program. It takes down barriers for women accessing treatment because men do seek treatment more often than women, actually. And like I said, if someone's pregnant and addicted, we really just work to take out all the stops so they get the help they need immediately.
Chrissy, this sounds amazing. It's wonderful what you and the Community Health Center are doing. Now, if I can ask one of the final questions before we have to wrap up our interview today, the baby, the outcome for the baby when born after, their mother has been battling this addiction.
Yes. But really, we cannot predict exactly how the baby's going to react. So the baby has been, been receiving some level of Subutex through their system. So when a baby's born drug affected, they're given a medication when they're born, and they can recover from that in a week. It could be 2 weeks. It could be up to 8 weeks. But it just really depends. Every case is different. They always say they can't really predict it, but the baby doesn't suffer. You know, the baby could have fetal alcohol syndrome. It could have a whole host of other problems being born drug addicted if the mother was living on the street. So this is something that we can control once the baby is born. We work with the mother so that they can stay longer in the hospital. They can visit them in the NICU, but we have plenty of babies that come back into treatment that I've seen, and every one of them just looks like any other baby. I mean, they're chubby and happy and plump, and you just want to eat them up. They're wonderful, and I fully believe that, you know, we do everything we can to get them back on track quickly, but it's a safe, and the hospital handles that. And like I said, we work really hard to make sure everyone is doing as well as possible.
For anyone listening again who needs help from the community health center, how can they get that?
Sure. If you're struggling with addiction or you have a family member that is, we serve adults and adolescents with many different outpatient programs. You can call our intake department at 330-315-2644. If you are over 18, you need to make that call yourself, because we are a self-referral program. That's important for people to know. And also on the adolescent basis, we have an entire adolescent building. It's a really nice doctor's office, easy free parking. That's where Adolescent Detox is and our outpatient program. So we're a great resource too for people who may need that.